यस सर, कर दिया मैंने आपको।
All right, ma'am. Thank you. A very warm good evening to one and all. As you all know that we have come together for a session on preparation and planning for the third wave, focusing on how to save our children. Let me tell you, ladies and gentlemen, that it is organized jointly by IQAC, Internal Quality Assessment Cell, St. Xavier's College, Jaipur, and COVID-19 Action Committee in collaboration with Department of Political Science. Very specially, I would like to mention that COVID-19 Action Committee has planned a series of webinars on COVID issues. This webinar is the second in the series. Next event of the series is planned on coming 14th June. Dear participants, it's indeed a matter of pleasure that we have with us today eminent guest, Dr. Reggie Salmon, who is working in Ministry of Health in Kuwait in pediatric ICU. Welcome, sir. And also we have Dr. Tarun Patni, who is consultant pediatrician in neonatologist in Life Care Hospital, Jaipur. And of course, it requires a special mention that Dr. Tarun is also an alumnus of St. Xavier's School, Jaipur. We welcome you, Dr. Tarun. Participants, it's indeed pleasure to say that we have our participants from all corners of India, from Sikkim, from Bhagalpur, from Andhra Pradesh, to Loyola College, Chennai. We have faculty members from Dausa, Rajasthan. We have a faculty member from Pune, Maharashtra, Savai Madhopur, Delhi, Tonk, Daruheda, Haryana. So it's almost like a pan-India webinar. And then we have, of course, Jharkhand, then sister concern of St. Xavier's, that is school CSK, Manevta have also joined. So a very warm welcome to all the participants who are here with us in today's webinar. Also, I just want to squeeze a little time to extend my gratitude to Father Rex Angelo, Principal, St. Xavier's College, Jaipur, for giving us this opportunity, though for some reasons he's not been able to attend the webinar today. To begin with the webinar, ladies and gentlemen, our esteemed guests are here to settle our doubts, fears, and confusions that persist in our mind on the onset of the third wave of COVID. Very especially when it comes to children, we look forward to get answers to the challenges that we need to prepare for. To start with, I request Reverend Father Dr. Nelson De Silva, SJ, who is Vice President of JXCA, Jaipur Xavier's Educational Association, to give a welcome address. Over to him.
Thank you, Dr. Denny. Dear guests, and especially the speakers for today, I welcome you all on behalf of St. Xavier's College, Nevta. I'm happy to be a part of this webinar. And when I was thinking of this topic, one thing which came to my mind is we are in such a scenario that we are into a firefighting mode. And when we are talking about the children, the citizens of tomorrow, the people of tomorrow who are going to live, I think apart from merely handling this COVID situation, yes, which is necessary at this time, what we need to do more is also equip them with resources so that they can continue to have a holistic growth and a holistic life. I think the biggest thing that we have learned during this COVID situation is that we are living a compartmentalized life rather than a holistic life. And that's the reason we are facing these situations. We have damaged the environment, we have injured the world, and that's where we are today. And when we read in positive psychology, we talk about three very important resources that we need. And I think being people from India, it is part of that spiritual tradition that we carry and any religion has, is one is giving hope, another is building optimism, and third one is building resilience. Yes, we will fight with COVID, we will take treatments and medications and all that, but there is also a need to grow from within. That is where hope, optimism, and resilience are important resources. And that is part of the spiritual tradition, growth in spirituality, respecting oneself, respecting the people, respecting the environment. And I think it is in that holistic way we will fight not only this disease and perhaps many more to come. So as we are here, I thank the guest speakers today for their time and their participation, and all others who are from various parts of the country and part of this panel discussion, raising issues, raising concerns, and perhaps finding solutions. And not only finding solutions, also becoming a solution or a positivity in the world and the people, in the midst of the people today. So I thank you again for being a part of this webinar, and I hope and pray that all of you will be benefited abundantly from this interaction and will be contributors to the world today. Thank you, and over to the guests.
Thank you so much, Father Nelson. It's really a matter of honor to have you here. Then I request Ms. Rose Martin to introduce our esteemed panel of experts. Over to Rose Martin.
Thank you, ma'am. Can you hear me?
Yes, ma'am. Yes, ma'am.
Good evening, everyone. It is my privilege to introduce our distinguished speakers of today. We have with us Dr. Tarun Patni, who is an MBBS MD in pediatrics. He is currently working as a consultant pediatrician and neonatologist in Life Care Hospital, Jaipur. Dr. Patni has held several eminent positions in the medical field, including being the president of Medical Practitioners Society, Jaipur, from 2015 to 2017, and was an elected board member of Central Indian Academy of Pediatrics in 2010 and 2016. Presently, Dr. Patni holds the position of president of the Indian Academy of Pediatrics, Rajasthan and Jaipur branch, and he is also the president of Jaipur Medical Association, Jaipur. He is also a proud alumnus of St. Xavier's School, Jaipur. We welcome you, sir, today.
Thank you. Thank you very much.
Our second guest speaker for today is pediatrician Dr. Reggie Samble, who works in pediatric ICU with the Ministry of Health in Kuwait. Dr. Samble did his MBBS from Shyam Shah Government Medical College in Rewa, Madhya Pradesh. He did his diploma in child health from CMC Ludhiana, and he also underwent Diplomate of National Board DNB training at Government Medical College, Trivandrum. We welcome you, sir.
Thank you.
Thank you, Dr. Patni and Dr. Samble, for joining with us today. We look forward to drawing important insights from your expert views. Over to you, Denny, ma'am.
Thank you, Rose. Now we formally begin. But before we begin, I would request our participants to write their question in the chat box so that we can direct it to the resource person as and when it is feasible for us. And my humble request to all the participants is to take care that their mic is muted in the entire event. Then moving forward, I would just ask panelist, that is Dr. Tarun Patni.
Yeah. Yeah. Can you hear me?
Yeah. Yes, sir. Yes, sir. Dr. Tarun, my first question to you is, I would request you to share your experiences with corona patients in the past 1.5 years or a few months. And have you ever been stressed would be my normal question, the first question that's coming to my mind, and your conclusions drawn from all your experiences. So over to you, Dr. Tarun.
Yeah. Good evening, everyone. And first of all, I would like to thank St. Xavier's College and Xavier's Jaipur for conducting this program. You know, I have been associated with NAVTA right when it was the genesis of St. Xavier's NAVTA. Father Phillips used to be there, and I used to visit it often and give talks on parenting as such for the children right there. So the first question of yours is actually a very complex question if I start answering. First is that, you know, COVID, if we analyze as of today, is the story which has involved everybody in the world. If we just analyze the commonest word which is being used and talked about at present is COVID, something much more than anything else which humanity has learned in such a short span of time ever. Now, if you just if I just in brief say that my experience with the patients with COVID and myself and my family, you know, as a doctor and as a parent of two doctors who have also passed from St. Xavier's Jaipur, who are also alumni, my son and daughter, and my wife, all of us are doctors. And when we work in seeing COVID patients or in COVID wards, we actually, this is the first time in medical history that we ourselves fear the disease. And the reason for fear is the
Dr. Patni, you are muted.
Dr. Patni? Yeah.
Yeah.
there's control with somebody else. Okay, now. So can you hear me?
Sir, yes, sir. Please continue.
The fear of the disease is there rampant amongst all of us as doctors. But still, we all are working and trying to find a solution for the all our patients and all others. And we try to give the positive picture as far as possible. In my own last 1.5 years of experience, I have seen both adult patients and pediatric patients. And the worst part has been that many of the time, whole family is involved with COVID disease. And when whole family is involved with the COVID disease, there is nobody to take care, especially of the children. And if the children are really in the phase of infancy or toddler phase, they fear the brunt the most. In a disease in which even the closest and the nearest one to you are not ready to help out there, then the children or expecting mothers suffer a lot when they are diseased. I have seen children when, even if they are not suffering with severe disease, they go into depression. They fear a lot about the disease because they had heard many things about the disease. I have seen children when even asked for the test of COVID, that is the nasal swab, they collapse. They start literally crying out of fear. And at that time, when the children are panicky and the family is panicky, it is very difficult to console them. That's why my really what I want that everybody should be prepared is many things which we will be talking in the future course of the program today. So you can continue and ask other questions, please.
Thank you, Dr. Patni. I would just say that, doctor community actually needs a hats off from, the entire world at this stage. Next, I would like to ask Dr. Reggie. Dr. Reggie, I would just ask, what had been your experience and how would you want us to understand COVID as a layman? And tell us something more about it.
Yeah, hi. Hello. Good evening, everybody. Thank you. First of all, let me thank Father Rex Angelo, Dr. Denny David, Ms. Rose Martin, and especially thanks to that I share the stage the platform with Dr. Tarun sir.
No,
It's an honor for me.
no.
And yeah, it's a wonderful moment for me to share my experiences out from Kuwait at this point of time. We have all had very unique experiences and unexpected venture of events happening over these last 1.5 years. So before I start to begin with, when we started off, none of us knew what was happening about 1.5 years ago. So I was just searching through some images and I got this. When we started off realizing that something's happening, we were all geared up. So looking back, when it all started, actually nobody had a clue that where we are headed for. The lockdowns began. There were panic buyings, I think, all across the globe. And we were all taking precautions when going to the hospital. There was initially the scarcity of PPE kits, and even to the surprise to know that the yellow or the blue gowns that we were wearing in our ICU was made in Wuhan. Then getting ourselves screened multiple times, anxiously waiting for the results, and then coming to know that the least expected and the most precautious person has become positive. So gradually, the extensive precautions are trimmed down, and now we move around with mask and the face shield most of the time. But as frontline warriors or workers, the medical fraternity, I think, has taken a toll at all fronts. This is what I feel. Especially at the workplace, due to the incessant hours of working under stress, with constant fear of contracting the deadly infection, unable to travel or take a break for almost for 1.5 years now. And at the home front, keeping away from our little children, our parents, afraid even to hug them, lest we are carrying the virus and we give an infection to them. In most places, I think the doctors and the staff were coming back to their homes only after their work. And the doctors, the staff have been also on the social front also, we have had to take the brunt many a times, I understand. The public at large takes this whole situation at a different level, at a different perspective, until COVID-19 strikes at someone close to them. And they don't want to accept their primary social responsibility to remain isolated or to wear the mask in a responsible way, keep the social distancing, and many a times end up squarely putting the blame on the medical personnel when a life is lost. Well, actually, on my personal front, as both myself and my wife, she's an anesthesiologist, and we have been in the thick of things. But God has been quite grateful to us that we have been safe through all this time and have been prevented from getting any infection. We have been careful enough to use the mask and to keep ourselves away from crowded places as much possible, avoid eating food in shared spaces. I especially mention this because as medical staff, whenever we get a break and we want to have food, we may be sitting around in a small space and having our food. So the chances of cross-infection is quite high at that time. And I have received my 2 doses of here we received the Pfizer vaccine for me. And regarding the pediatric cases, we have been lucky to see occasional trickling down of COVID positive children. And mostly some of them would be having some pre-existing comorbid conditions, becoming sick, but by the grace of God, all have recovered. And as in the other parts of the world, we also started to get, after the initial few months of the COVID positive cases, children trickling in with who were not initially COVID positive, but when we test them, they're COVID antibody positive, and we will be discussing about those issues in the further questions. So they are known as the MISC cases, and so in a nutshell, I can say that because in pediatric cases, most of them actually without much sequelae, they have recovered. So it is on a positive note from our side.
Thank you, Dr. Raji. My next question I would ask Dr. Tarun. Like the question, the common, because when it comes to a layman, so these questions are quite common. And this question is like, how long does the corona last on surfaces? So it says that it depends upon temperatures. At times, if it is hot, it would die soon. Or, if it is moist or winters, it would survive for a longer time. So these are some myths. And I would ask Dr. Tarun to throw some light on this, that how long does the corona last on surfaces from the medical point of view?
You see
Dr. Tarun.
yeah, one of the important things, the most important thing to take precaution is from aerosol spread. That is spread of virus from a person to person spread through air. That is the most important thing. As of now, the latest research says that transmission and survival of the virus on hard surfaces is not at all that worrisome, because the virus mainly spreads and through air and through droplet mode. So the most important measure which we all should take is distance ourselves from any other person who is a potential case of COVID. The distance between two people should at least be, as far as possible, more than a meter, but the best is it should be around 2 meters, that is 6 feet. And the next important thing is the closed compartments, which Dr. Samuel had already discussed. Because the virus survives in closed chambers in the air for a pretty long time, and if you contact your airway contacts the droplets which are containing the virus from a person in a closed compartment, the chances of getting infected are very, very high. So the precaution which we all should take is that we should have ventilated chambers and even vehicles in which we are moving from one place to another with somebody else. So my advice will be that if we are traveling, then the windows of vehicles, that is cars, buses, should be at least 4 inches open, so that there is air circulation and the virus does not stand still in uh, stagnant air. So that is the most important. As far as your question, that survival of the virus on materials like cloth, paper, newspaper, and hard surfaces, that is not much relevant nowadays. So mostly the precaution is that we should avoid air droplet infection. That is the most important thing. In dry weather, the virus survives very, very less, especially in a dry weather like ours in Rajasthan at present, when it is reaching 40 to 44 degrees Celsius. So don't worry that much. That is hard surface transmission. Give relevance to air droplet infection.
Dr. Tarun, there's another, I mean, the myth that, if you walk past by a COVID positive person, you're likely to have that infection. Is it true, or is it you
No,
actually get?
this is actually a myth. there is no need to fear walking past a COVID or a person who is potentially COVID. There is no need to fear. If you travel, and the only thing which you have to worry is that if somebody is COVID positive or having chances of corona, your contact time should not be as far as possible more than 15 minutes with such a person. If you both, that is the person and you, are both not wearing mask and the distance between two of you is less than 3 feet. So if the distance between you and the other person is more than 3 feet, and if both of you, that is the person who is COVID positive or is a COVID patient, and one, you yourself, and if both are wearing masks, there is not much to fear. But still, we should avoid two things. Contact time less than 15 minutes is the thing which should always be kept. And second is, we should be meeting in open spaces as far as possible. The chambers should be open, the windows of the chambers should be open, the cars, vehicles, traveling areas should be open. And if in a park, if we are passing by a COVID patient, there is nothing to fear as such.
Uh, Thank you, Dr. Tarun. And Dr. Reggie, my next question is like, you have already said that you have taken your 2 doses of vaccination. And, I would just like to know that what views you hold on when it comes to vaccinating both adults and children. And also, how long will the COVID vaccine protect someone? Why? Because there have been many cases, as in the newspapers, that it has come that after being vaccinated, the person has been infected with COVID. How true are these newspapers, and how to rely on an hour vaccination to be given to both adult and children? So what are your views on that, Dr. Reggie?
Yeah, one sec. I would want to share a screen on this. So regarding the vaccines, we now see that approximately 8 of the vaccines are in the market, as one of them only is still continuing as a phase 3 trial, but we have now 7 definite vaccines which are in the market for the whole community. And for children, especially now that Pfizer have come out with from the age of 12 years to vaccinate. Moderna is in the process. Covaxin is planning out for trials in children. So before we go on to understand, I want to stress upon what is the impact of COVID in children. One thing that we should understand is the children are most of the time asymptomatic, or they are mildly symptomatic. But now a child, if he becomes symptomatic and he requires a hospital admission, then we see from the recent histories that out of these 3 children who are getting admitted, about 1 of them definitely requires an ICU care, a tertiary care support. So that means that the child is getting critically sick. And we find that most of them have a presentation of either fever or as gastrointestinal symptoms in the initial setting. And as I was just mentioning prior, we find the condition of MISC, which is a multi-system inflammatory syndrome in children, which is a dreaded complication in the sense that here the children require intensive management to control their complications that are arising, the associated issues of utmost care for this child to come out without any sequelae. And therefore, a prompt identification and an appropriate management is required as to have optimum outcomes. So with this understanding, we should try to find out. I will try to relate to you why a child needs to be vaccinated. So what happens is a child, if he is infected, he is a potential source to transmit the virus, even when no symptoms are present. So the vaccine protects against the above mentioned potential harms to the child and also to his family members and friends, especially those who are susceptible to this infection. And there is also a far reaching ripple effect when we try to vaccinate the younger age group. So it is to protect the health of the broader community. What I mean here is the herd immunity. So each child or an adult who is infected provides a chance for the virus to mutate and to create a variant that might become more dangerous and eventually become resistant to available vaccines and the limited treatment options that we have at present. So fewer infection in population means less chance of the risky variants happening. So, and also it is quite possible in the near future that to rejoin classes, some schools and colleges may even come out with this requirement that the child be vaccinated as a mandatory issue. And we find already that happening in the international travel requirements in many of the countries. I think that makes clear the primary part of it.
Yeah, Dr. Reggie, just associated with it, there's a question that it has been seen that COVID vaccination have an adverse effect on people having allergies. Is it true?
Okay, so what happens is in a normal setting, I will just have a slide on that. So, see, what we should understand here is that for a general normal vaccination, when a person gets a normal vaccination, the risk of anaphylaxis happening. Anaphylaxis is a potential life-threatening event that happens from any vaccination is about 1.3 in a million vaccines. So here also initially there were fears that certain vaccines cause major allergic responses. But now after these millions of doses of vaccines of all the varieties being given across, we have found that it is very, very minuscule, almost like any other vaccine. So hence, and also that we find it is just the common issues of tenderness at the site, the swelling or some swelling or redness at the injection site, some amount of headache, some muscle aches, some fatigue, that is tiredness, and fever. But these issues are seen usually up to about 48 hours. And it settles within this time. So it is not a significant factor to say that there are major adverse events commonly associated with any of these vaccines for COVID which are available at this point of time.
Dr. Reggie, we have a few questions related to vaccination coming on chat, and I request Ma'am Rose Martin to take over those questions. Probably it's directed towards you. Ma'am Rose Martin. Ms. Rose Martin, can you hear us?
Hello.
Yeah, please continue.
So we have two same questions coming from two people. We have Priyanka Goel asking us, after how many months a COVID patient should go for vaccination? Dr. Patni can answer.
Yeah. You know, if the patient becomes COVID positive and after he gets cured, there can be two situations. One is that he is not at all vaccinated. And second situation is that he has taken one vaccine dose but the second is remaining. These are the two most common situations which we encounter. So regarding the first question, that if a patient has not at all received COVID vaccination, then he should start with the COVID vaccination course after 3 months of getting cured from COVID. That is, after he becomes RT-PCR negative, and after that, 12 weeks of that, he should receive the first dose of COVID vaccine. Now, the second question comes is that when should he receive the second dose? So that depends upon the vaccine he is receiving, he or she is receiving. If, say, a person has received Covishield, that is the Serum Institute vaccine, then he should take the second dose after 12 weeks of the first dose. And if a person has taken Covaxin, the Bharat Biotech jab, then he should receive the second dose after 4 weeks of the first dose of the vaccine. And the first dose is usually 12 weeks after getting cured from COVID. That is the thing. And second thing is that, say, if a person has received one dose and he gets COVID positive and he recovers, then the second dose of the vaccine should be 12 weeks after recovery from the disease. That is the schedule which one should follow as of the scientific evidence available at present in India and worldwide.
Thank you, sir. We have another question from Akhilesh Goyal. He's not specific about like what he's wanting to ask, know about asymptomatic persons. So he just put, what about asymptomatic persons? Dr. Reji, yes.
Yeah, Dr. Reji will answer. He should unmute himself.
Yeah, sorry. So by asymptomatic, if you are saying regarding vaccination, then if you have been COVID positive but asymptomatic, still, as Dr. Tarun said, it stands that the 12 weeks gap is required, preferable for you to get your vaccination if you were COVID positive. If asymptomatic, in the sense, what happens is there need not be, like in a child especially, or in an adolescent, you might not have the full features of the COVID symptomatology coming up. But for an adult, if the person has been COVID positive because he got exposed to someone and he checked, he is COVID positive, but he is continuing to be asymptomatic. Uh, the the fact of the matter is that he will be producing antibodies, but then better to wait for the 3-month period and to go for his vaccination.
Thank you, sir. Denny, ma'am.
Yes, ma'am. Okay. Thank you. My next question I would ask Dr. Tarun. So, what is the early sign of uh, detection of coronavirus? What is the early sign? Because if you have fever, people say that it is viral, or they assume that it should be COVID. So there is little confusion. So what actually, in terms of medical, you would say these are the early sign of detection of coronavirus, Dr. Tarun?
You see, the early symptoms which a person can think that he has COVID is that in the present era, that is in the present time, when COVID is in an epidemic phase, that is, it is pandemic worldwide. If any person gets fever, along with fever, he has, say, adults can have other features, but in children, if a child gets fever and he has got gastrointestinal symptoms like loose motions, vomiting, pain abdomen, or rash on skin, he should immediately consult a doctor and get himself or herself investigated for COVID, because at present we consider every fever patient as a potential COVID. And the reason to detect early are many. First is treatment of the individual person. Second is isolation of the person so that he or she does not become a root for others in the family and the society to be infected. That's why we should investigate early and pick up the cases as early as possible. And third reason is that the major way to control the disease and the epidemic is trace the patients. That is, we have to be proactive, and little symptom in a family in which already a COVID patient is there, we should not hesitate in getting RT-PCR done. And RT-PCR is available very easily in India by chance, and the cost is very less. So please, whenever you think that if you have fever or GI symptoms like loose motions, vomiting, diarrhea, or rash, or loss of smell, loss of taste, we should think that we have COVID and go for investigations.
Dr. Tarun, uh, just as you have said about it, I would just ask that when a person is exposed to virus, so how long does it take that is exposed to virus and when they start showing symptoms?
You see,
Is there any fixed duration for it?
yeah. There is a fixed duration. If a person gets exposed, that is reasonable exposure is there with a COVID positive symptomatic or asymptomatic person, then mostly the patient who has come into contact will start showing symptoms mostly within 3 to 5 days. But the maximum duration for which one has to take precaution is 12 days. So if a person does not show any symptoms from 10 to 12 days, then patient has been exposed, but himself or herself has not got infected. So maximum duration we should wait for is 12 days. So that is the isolation period also which has been kept.
Also, that how long do these corona symptoms last? When they show up?
The symptoms lasting in corona is very complex thing. One is due to disease, and second is due to complications of disease after recovery, what we call as long COVID nowadays. So if any patient who has become positive, usually they take, if they are only mildly symptomatic, they will take 10 to 12 to 14 days to recover. If they have got moderate to severe disease, usually the recovery time is around 3 weeks. But the things don't end here. In asymptomatic, mildly symptomatic, or moderate or severely symptomatic, the patients can have long COVID complications. Long COVID means that the patient COVID test, that is RT-PCR, will come negative, but he will be having autoimmune symptoms like heart ailments, myocarditis, BP ailments, then diabetes flare up, then respiratory complications, कि जिसको बोलते हैं हम सांस की दिक्कत रहना. This usually comes later on and can stay for even 3 to 6 months. So we have to be very careful for 3 to 6 months after even recovery from COVID. It is not to be very panic about and fear a lot, but precautions should be regularly followed for 6 months after one recovers from COVID. And if any symptoms develop, say सांस की दिक्कत होना, respiratory distress, or syncope, that is the BP falls or the pulse rate falls, one should immediately contact a doctor and get carefully treated. That is the thing.
Okay, thank you, Dr. Tarun. Dr. Reggie, I would like to ask the question which has been quite, bothering us. That what is the possibility of the third wave of COVID-19 in the coming months? And it has been assumed that it is coming, and there's a little fear among the people. So, what do you think the possibility of the third wave, Dr. Reggie?
Yeah, the thing is, we understand now from across the world, as the things are happening, that these waves, as we see, the second wave, third wave, now there are countries going in for the fourth wave. So whenever there are large number of cases, there will be mutations and variants coming up for sure. And till a level of, as we say, that the herd immunity is reached. So in our scenario, we should be expecting the third wave as our second wave phase is gradually weaning down. But soon enough, we can expect the third wave, as we have seen in across in US, in Canada, in UK, the third wave, the how it has presented itself. So definitely there is a incumbent time that the third wave sets in soon. But we should be prepared is what is more relevant at this point of time after having had a tough time with the second wave.
Yeah, Dr. Reggie, there's one more associated question, and that is that it will be the third wave will be severe, and it will take a toll on children. It's what we hear. So why do you think that children could be impacted more if in case there is a third wave?
Yeah. So what we have seen is initially the community who were affected more is the elderly people. World across, we saw that happening at the initial phase. And as it progressed to the second wave, we saw the age band coming down to from 30 to 45. The age group were significantly affected. And so in this process, what happens is the vaccination drive is also going on, and the from the elderly and the comorbid condition people, means people who are having other illnesses, have been given the priority to be vaccinated. And now we have the the above 30, we have the vaccination going on. So definitely now the vulnerable group that remains is of the younger generation. And the demographic profile of our country is such that we have a large population base of the younger community. So keeping this in mind, we have to be prepared, and we should understand that they are the now possible target population, the younger generation. So in this background, I think we should be prepared for it.
Down the corner chat box, there's so many questions, and I request Rose to address those questions. Rose, ma'am.
So we have this question related to a child having mild infection. So if a child is having mild infection, will he be given steroids in lesser quantity? If yes, then what could be the side effects of it in the longer run? This question to Tarun sir.
You see, one thing is there that all should know that children, when they get mild infection, they don't need steroids at all. We will never give steroids or anticoagulant to a child who has got mild symptoms. Only thing which parents need to know is that early detection will help in controlling the spread of the infection in other adult family members. So if a child is mildly symptomatic, Just give some symptomatic management. Say if he has got fever, give treatment of fever. Second, give him normal diet. Third, encourage him to be active and properly hydrated. Hydration means that he should be taking lot of liquids and normal diet. And fourth, we should treat the psychological aspect of the child. We should not let child suffer silently and get depressed and fear that something very bad will happen to him or her. This is happening when we become excessively cautious. So whenever a child who is mildly diseased comes to me, I tell them few steps to follow and few steps to be vigilant about. What is to be vigilant about is that if the fever persists to a very high grade for more than 4 to 5 days, they have to get investigated. One. Second, they have to come back for that. Third, if the child develops severe cough, then we have to be very, very cautious. And one of the most important thing, if it happens, that is, if the child becomes dull, lethargic, and sleeps for the most of the time, then the parents and the doctor has to be very careful and deal accordingly. But for mild symptoms, there is no need to panic, no need to give steroids or anticoagulant. That is my answer.
Thank you, sir. So we have another question. As we speculate, the third wave is also going to come soon, and it is most likely to affect the children because elderly people are vaccinated now, but children are not going to get vaccinated anytime soon in India. So, what precautions do the children should be taking while they are playing outside to safeguard themselves from the third wave of corona? This question to Dr. Reji.
Yeah, the thing is, as I was just saying, that we are expecting the third wave to soon come anytime. We are not sure the timeline though, but then, and the younger generation is a vulnerable group. But having said that, it doesn't mean that it will be solely in a rampant way all through into the children. But at the same time, the precaution definitely needs to stay that the mingling in crowded regions are limited. And when we see that a spike is beginning, if and when it starts, at the same time we should be now what's happening is I think the vaccination drive is again on a full swing, and the trials are ongoing for the children from about I think 12 years of age. Uh, Already, as I said before, certain vaccines have accepted giving. The trials are over and have started giving in the certain countries to the 12 above children. So, and now these vaccines are also going to be brought in, I think maybe to our country too. It will be an open market, and that is one option that would be available to get the children also vaccinated. And in the meantime, our own vaccine trials, as they bring out the results, we will be having the option of vaccinating our children with our vaccines itself. And at the same time, what we should understand is the children, mostly they are, as I was discussing earlier, their symptomatology is different from that of the adults. And most of them are going to be mildly symptomatic, if at all. So we have a very less percentage and possibility of a child getting admitted. Only if he's getting admitted, the possibility of he progressing or becoming sick exists. So that gives us, as we have seen in the other places of the countries developing the third or the fourth wave, we see that the children, around 25% of the children may get infected, but the admission rates are, and the alarming picture that we have seen with the second wave might not be happening with the children, hopefully. We are hopeful. Dr. Tarun wants to add on anything.
Yeah, actually, you are right, Doctor. Actually, uh, they have really exaggerated the involvement of children and fear psychosis as in overspread. And at present in India, second wave is going on. We have to deal with that rather than the fear psychosis, and people are afraid to take care of themselves at present and fearing for the children for the next wave. That is not the right approach. And children will not be that severely affected as we all know. So I think that fear should not be there. But one thing is definitely for sure, that schools and teachers should be well aware of the precautions to be seen and followed every day in the schools. That is very, very important. Because in India, there are around 25 crore children who will be going to schools. And if these 25 crore children, out of them, even if 10 to 12% become infected, they will be again a source of spread throughout India. You can just imagine 25 crore means 10% means around 2 crore children can become infected in the coming time. So we have to be very, very careful. That is the only thing. And teachers should be knowing and taking all the precautions.
I
And
just, yeah,
yeah,
sorry. I
please
just want to
continue.
add one more thing here. Even though it is our crux of issue is on COVID. One thing for children at this point of much more significance and importance, I feel, and the Indian Academy of Pediatrics stresses on this, is that these children, they sitting back at home or a stressful situation that their parents are dealing with, the mental health issues and the screen times are the greater concerns for in the child group is of which we should be putting or stressing upon. Uh, I feel.
You are right.
Uh, Dr. Tarun,
Yeah.
just as you are saying that, we have to first prepare ourselves to deal with the second wave. There's another question which is, attached to it is like we hear of new symptoms of more anxiety and more virulent strain of virus. So how many children are actually admitted? What is the status that admitted in your hospital now through the second wave? You know,
I will tell you that I may have seen many cases with COVID, but not a single admission because of COVID in my hospital as of now. Mostly asymptomatic or mild, and they have been dealt properly at home with minimum medication. Most important is just monitoring at home, and if the only problematic cases which I have come across are MISC, which Dr. Samuel talked about. That is the thing which we have to be careful. That means that the child comes with, say, fever with more than 3 days, loose motions, vomiting, respiratory distress, or in shock, and he has already recovered from COVID. Those are the cases which we need to be careful about, and they can be very, very serious, and they need admission and proper intervention and treatment. So that is the most important thing. But COVID as such, not many patients who become serious and get admitted.
Dr. Raji, what is the current status? Continuing that same question, that do you have in your hospital the cases for the children who are admitted with this disease, and what is the percentage?
Yeah. So exactly, it is the same scenario as Dr. Tarun is saying that direct COVID positive cases is a very minuscule number. Rather, what we have with us is a presentation of, sorry, just a moment. What we have is missed cases, and these missed cases, we have to be cautious in handling them because they, as a matter of fact, if we are not taking care of them at the right moment, we may end up with increasing complications on them. Just a moment, I just wanted to show you a slide on this. So, missed usually they can have multiple or the WHO defines them as there will be 2 or more organ involvement. Like usually they may come with, most often they come with low blood pressure, or they have persistent fever. That is how they are presenting to us. You can see that there is a child who came to us with extensive rash and fever persisting. So this is a autoimmune process which is happening. Autoimmune process, I mean to say that the antibody, after either the child has had a COVID infection, or most of the time what we see is that they have been exposed to a COVID positive person. And many a times we may not get a history, but if we test their blood, they may be COVID immunoglobulin, the IgG positive for the child. And these children, after some 3 or 4 weeks, they may present with some rash or fever or diarrhea, as Dr. Tarun was saying, and eventually they may end up having difficulty in breathing and come for admission. At that point of time, we have to give them steroids, and we may end up giving them something called the immunoglobulin, IVIG, and appropriate antibiotics may be needed for secondary infections. But other than so, this is once in a while we get a child in this scenario, but then again, it is not a rampant number of cases that we get.
Terry ma'am. Okay, I'll take this opportunity
Yeah.
to ask one of the questions from the chat box. So this is a vaccination related question. What do we mean by the second dose of vaccine? Is this a repetition of the vaccine, or is it different in properties? This is Dr. Chandar Kavar asking Dr. Tarun.
You see, as far as both the Indian available vaccines are concerned, this is repetition of the same dose and the same amount of the first dose. This is in case of Covaxin and Covishield vaccine, which are being used at present in India. It is a booster, same like, as you people are teachers, you have to teach everybody, every child, at least 2 times or 3 times. Then only the student's brain remembers the subject, isn't it? That means you have taught once, and second time you are teaching, it is the booster dose, the second dose. Similarly is for the vaccine. Mostly we need vaccines to be given at least second time or third time. In case of COVID, it is only second time, so that the memory cells of human body remember the disease and to react against the disease. So the vaccine of the first dose and second dose is exactly the same volume, same dose. That is it. Nothing more than that. Except in the newer vaccine, which we will be getting, the Russian vaccine, the Sputnik. In Sputnik, the first dose and second dose vary as per the component of the vaccine. That's why the newer vaccine of Sputnik, which is coming, is Sputnik Light. So this will be only one shot with the people will be needing, and that will be coming soon. In that, only one dose will be needed, Sputnik Light. That will be coming in India after a month.
Also, I just would want to add on one more thing. Like in the international scenario, also they are now even mixing the vaccines. So somebody who's getting the Covishield or the Oxford AstraZeneca vaccine may get a dose of the Pfizer vaccine. So all these trial and the changes in the regular dictum is going on. So we cannot be sure on the combinations that are being tried, and we will be seeing the results in the near future. We are yet waiting to see.
Thank you, sir. Next question we have is related to child psychology. Since many of them have spent almost 1.5 years indoors, and it is affecting them psychologically. They are not getting social anymore. They don't get playtime outside. In fact, they have not seen outside world for a long time. So, what advice you can give to the parents to take care of children who are now at home? Dr. Reji?
Yeah, from definitely me being in a setting where most of us are in flats and we are restricted. The children have to have the day schooling, their schooling from online system only here. I think in India also, many of the parents might be facing the same pressures and the situations when the children are constantly under the care of their parents, under the stressful situation the parents may be going through. It is again it's a very complicated issue that even the parents are facing for the first time. They have to take the pressure from their job. They have to adjust to all these new electronic gadget activities to settle for their children. The child has to perform in the class on online basis. He has to settle with his the without a friendly atmosphere. It might not be a friendly atmosphere for him. Uh, so it's a very tough dynamics happening there, and the, also the tendency for the child to remain glued to the screen for longer hours, and eventually affecting his studies, affecting his vision, affecting his physical health, his mental health. So definitely the role of the, I feel, the parents to not to be on a, the parents also get too stressful sometimes and unknowingly relay it to the onto the children. So the there should be some counseling sessions, I think, from the schools or from organizations to the parent groups as well as the children in between to uh, understand what their stress situations are, and to allow them to open up, uh, because it is just the even though the parents are there for the children, but then this is a scenario we are seeing that people are getting admitted. Uh, there are others, neighbors or relatives who are having to take care of the children. Parents, so many parents have been devastated uh, by unexpected deaths occurring, and the situation is definitely very alarming in many places. So the approach to children here has to be on a very tenderly basis from the parent especially, and from the teachers also. I feel the young generation, the college going children, even they may be not be able to relate out to the community what they are going through. So definitely we need a good amount of counseling sessions to be involved hereafter, I feel. Dr. Tarun can also put in his views.
Yeah, Dr. Samuel, I was thinking one thing, that because I am involved a lot in parenting and all, the schools should stress upon certain other things apart from classical education as of now. Children till fifth or say eighth, even in online classes, one thing is for sure, they should be made to follow certain routines at home. Because what I am finding is that children are not loving the mere idea of going back to school nowadays. They are not liking that they should get up at time, dress, and go to some other place. Even today, when I was interacting with few of my patients, I usually ask one question to all children, that how you are liking this COVID and not going to school. I ask this question very often. And invariably 80% say that we don't like school, we are enjoying the way we are living. And the reason is that none of the schools has stressed upon certain routine to be followed, one thing. And second, schools should stress upon non-classical education as of now. Instead of online teaching only of cramming books till 8, children should at this time should have been taught various things, say like painting, carpentry, electricity care. They should have been involved in certain jobs type of things, which could help them in learning many other parameters of human life. That window still can be used, because next 3 months again, I have given this talk to many schools, that please try to teach certain things which are non-classical education if you can, and ask them to report online only, so that other children are encouraged. Cooking is a thing, doing household chores is a thing, but the important thing is that routine should be taught, that they have to get up at say 8 o'clock, then get dressed, then the online coaching and other non-classical education should be done, which I am finding has not been done, and this part will be very difficult to be tackled in coming days. Sending back children to school will be a big problem. I don't know how to solve it, but that will be a big issue. I don't know. I think the teachers can add to the story more than us.
Thank you, Dr. Tarun. It was a great insight. It was like out of the box answer. Thank you so much for that insight.
Observe and tell me whenever we meet next time. I will ask Father Philip and Jose and others. Let us see what is there in store.
Yeah, sure. Now, I just like we are coming to a conclusion. So I would just ask Dr. Tarun only, are we prepared, to ask you that question? Are we prepared to face a third wave of COVID-19 in Jaipur? So what would be your opinion? Are we prepared? Because I think in your previous answer, you said that first let us deal with, the second wave of COVID. So you're positive that we may not have. But if in case it has, are we prepared?
You see, we will have third wave for sure. Nothing can stop that. The only thing which can potentially stop third wave is vaccination. And surprisingly, in India, that has been lagging far behind than required those. Okay. So third wave will come because it is the natural cycle of virus. It is same like as we grow. We are born as a child, then our youth is there and adulthood is there, and then we go away from the world. Same is with this virus. So third wave will come. Now the question is preparation for the third wave. So my advice will be preparation should be at various level. One should be at family level. Second should be at school and society level. And third preparation has to be at the medical fraternity and medical infrastructure level. Now, the most difficult part is the second level, that is society and at school level. That is the toughest to deal with, because society is not ready to pick up things and pick up the disease very fast. They are not ready to follow SMSV, which we call, that is sanitization, masking, social distancing, and vaccination. SMSV is the acronym which we should follow, and we should be ready that whenever a third wave comes, we should be ready to intensively apply this SMS protocol, because that is the most important thing. As far as the medical infrastructure is concerned, medical infrastructure, if the third wave comes seriously that bad as the second wave, I am for sure for children, we are very, very poorly equipped in India. In Jaipur, we have few NICUs and PICUs, but the number of cases which we can cater in a city like Jaipur is very, very less. Forget about the periphery and smaller towns. But as far as I am concerned, because I am sometimes involved in advising the government, my advice to you and government, everybody is that in schools, if a COVID child comes and if he becomes sick, you should stress upon only giving the primary care and oxygen. So every school should be equipped with an area where oxygen is available in ample and can be given. In the meanwhile, the ambulance and doctors can come and take the child. One thing is there. Second, the staff should be trained to handle such complication, and if possible, every school should be in contact with a nearby hospital. This should be an investment on child care for the schools. The financing of this investment is as per school. It can be from school side, it can be from teacher side, or it can be from government side. But one thing is for sure, every school should be in touch with a nearby hospital, and they should have a area of at least 2 to 3 cots which can give oxygen. This preparation should be there at school level. So please try to arrange that and teach in your college and school that we have all these facilities, and the further medical infrastructure things are being increased because the government is also expecting. So hope things are better.
Thank you, Dr. Tarun. I think it will take some time, but it's high time we think on these lines that in the school itself we provide these facilities if we actually want to be prepared for the third wave. Now, I think we should open the mic for the participants too, if in case they have some queries. Ma'am Rose.
Yeah, if anyone likes to raise any questions to the speakers directly, please use the raise hand option below, and then we'll give you a chance to speak. Yes, we have Ma'am Sunita Yadav. Ma'am, please unmute yourself and ask the question.
Hello, can you hear, ma'am?
Yes, very
Yes,
much, ma'am.
yes, ma'am.
Yeah, my question is, why the sugar levels go so high after this COVID treatment, and like they're not coming under control? And second is, in spite of having the symptoms and everything, every time the report is coming negative, but the severity is very high. Why is it that? Because the sugar level I'm not able to control.
Sunita ma'am, you are directing this question to any specific person? You want
To Dr. Tarun.
Okay. Now I will tell you one thing. First is why the sugar levels go high. There are two reasons. One is if a person is already diabetic, then this infection, along with the treatment protocol which we follow, if the patient becomes serious or moderately severe, in that we have a drug which is called as steroid. Either methylprednisolone or Dexona is given, and this steroid leads to hyperglycemia, that is the increase in sugar level. So if a patient is already diabetic or is pre-diabetic, that is he has got abnormal glucose tolerance test, then treating the disease and adding the steroid in the regime can lead to increase in sugar level, which has to be treated by drugs and even sometimes by insulin injection, depending upon the condition of the patient. I think that is the thing which you can think. And after recovery, say if the patient continues to persist, have high sugar, and even after stopping the drug, sometimes the reason is that this disease leads to multi-organ involvement, and can lead to involvement of pancreas, which will lead to decrease in secretion of insulin, and hence a person can become diabetic. So this is the thing.
Okay. Thank you, doctor.
Sunita ma'am, you can now lower your hand in case your questions are now answered, or if you have any other question, you can still ask.
Thank you.
Okay, ma'am. So we have next hand raised by Mukesh Kumar. Can you please unmute yourself and ask the question?
Yes, good evening, everybody. My question is that how relevant is the use of blood thinners in the post-COVID? And it was not in the first wave. So, how relevant is the use of blood thinner in the post-COVID? And if it is yes, then for how many maximum days we should take these blood thinners?
Dr. Samuel, you answer?
Yeah, actually, from the pediatric perspective, only if the cardiac function is low, or in a case of a high coagulopathy state, we are continuing with aspirin or other blood thinners, Clexane. But for the adult population, I'm not very sure on the duration, how long it's given.
You see, why we are using blood thinners? This is clear because this disease leads to excessive intravascular clotting. That means blood can clot in the body itself, and that is the major cause of disease mortality and morbidity of the disease. And that's why blood thinners are started in every patient who is moderate or severely infected with the disease. And similarly, if after the recovery phase also, this persistence of hypercoagulability, that is the coagulation which can occur, persist in an individual, so blood thinners should be continued. And as far as duration of blood thinners is concerned, minimum 4 to 6 weeks of duration of blood thinners should be given. And if a person is more than 50 years old, then ecoaspirin, that is low dose aspirin, can be continued for even 3 to 6 months. It is not at all harmful because it will control the hypercoagulation of the blood, and the long COVID, which I was talking of, that is the prolonged COVID phase of the disease, will be dealt properly if long duration of anticoagulant is given.
Thank you, sir.
I think many questions have been solved. And Dr.
Yes, sir. We are running out of time. We have another question. Mr. Amit want to ask one. Dr. Chandra, I think you both are tired also. I'll ask Rose very fast. If Amit sir can wind up his question, we can ask. Give him the chance. Ms. Rose?
Yeah, very, thanks, ma'am. Very good evening to all of you. I would like to ask that, doctor, I'm yet to vaccinate myself. May I know that which vaccine should I go for? Should I go for Covishield or Covaxin, doctor? Thank you so much.
You see, my answer to this question is go get vaccinated, whichever vaccine is available and easily approachable for you. Don't wait for the variety. Both are equally good. Both are reasonably effective. So whichever vaccine you can easily get, go for it. That is the answer. Please
Okay,
don't
doctor.
be confused in which one. Go for the vaccine. That is the answer.
Okay, doctor. Thank you.
Okay. We have come to the finishing line of the program. I hope that all of you have been benefited by it and equally have taken a lot from both the doctors who are like very busy. Dr. Reggie, I know he's been 24 hours sometimes like on duty. Dr. Tarun is also very busy. Thank you both of you for being here. Just coming to the end of it, I would just say, a heartfelt thankfulness to both the doctors for such an insightful session. It was indeed, you know, it was indeed informative, and it has broken some of our established myths associated with COVID. And certainly we have explored some newer aspects of it. With this note, I request Ms. Pushpanjali Seni, who is the coordinator for COVID-19 committee, Ms. Pushpanjali Seni, to render a vote of thanks. And before that, I request participants to check the chat box for the feedback link and make sure that you fill it before you leave the meeting. So I invite Ms. Pushpanjali Seni.
Thank you, Danny ma'am. Am I audible?
Yes, ma'am. Very clear.
Very good evening to one and all present here. Before we conclude, I would take this privilege to thanks and express my heartfelt gratitude to our eminent speakers who spared their valuable time to share their insights with us despite being extremely occupied in this pandemic. Thank you, Dr. Tarun Patni, sir, and thank you, Dr. Reggie Samuel, sir, for nicely explaining the facts and patiently answering the queries of the participants. Thank you so much for the very great work you are doing for the country. I am extremely thankful to our principal, Reverend Father A. Rex Angelo, for giving us this opportunity to spread awareness about COVID amongst the faculty and the students. Thank you, Father. I extend my gratitude to Father Sherry George and to Father Raymond Cherubin, Vice Principals, St. Xavier's College, Jaipur, for their constant support in all the endeavors we pursue. I also extend my heartfelt gratitude to Father Nelson for his blessings and words of wisdom. My heartfelt thanks to the IQAC committee, media and website committee, faculty coordinators Dr. Denny Shachi and Ms. Rose Martin, and COVID-19 Action Committee members for all the minutest to the greatest help they have extended for the smooth conduction of this webinar. Last but not least, I am thankful to all the participants who have connected with us from the various parts of the country. Without you, this event would not have been a success. Thank you. I request once again to all the participants to kindly fill the feedback form before leaving this session. The feedback link is provided in the chat box. Kindly fill the feedback form. Thank you to one and all.
Thank you, Ms. Pushpanjali. Ladies and gentlemen, learning together with you all have been a wonderful experience. And I request all the participants to just switch on their cameras so that we take a quick picture. Ms. Rose Martin,
Yes,
please
ma'am.
switch on the cameras. All of you switch on your cameras so that we take a picture.
Done, ma'am.
Thank you. Wishing you all a healthy life ahead. And signing off from here is Dr. Denny Shaji and Ms. Rose Martin. And as reminded earlier, next event of the series is planned on 14 June. We anticipate your active participation in the next event too. There's been a lot of Thanksgiving, but once again, it's like, us thanking again to the resource person. We are overwhelmed with your presence, and we feel honored to have you here and to have you being addressed so many queries that we had. Thank you, both Dr. Tarun Patni and Dr. Reggie Samuel, who has been here right from Kuwait with us. So thank you, both of you.